Hello everyone, welcome to Talking with Dr. Laz, your favorite health program on television, reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. On the program today, we'll be talking about a very important topic that has to do with our health system, the primary health care. How can we make our primary health care stronger? How are we performing based on the policies that's been made by the federal government of Nigeria as well as the states of the federation? In 1978, world leaders and health experts from all over the world met at the International Conference on Primary Health Care at Alma-Ata in Kazakhstan. And they made a declaration, a very significant one for that matter, which has guided the operations, the policies, and of course the implementation of primary health care the world over. Let me bring that declaration to you. I will display it on the screen. Primary health care is essential health care based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. That's a long one. I recall when we used to cram this definition while in medical school in our public health classes. But it's a lot of things. If you begin to break down this declaration, there's a number of key words and key languages, which will not go into the details now, but Nigeria has made a number of policies, especially in the last 2-3 decades, aimed at helping to achieve primary health care and also making it sustainable. Of course, as Nigeria joins the rest of the world to try to achieve universal health coverage in order to meet SDG, Sustainable Development Goals 3 agenda by the year 2030. Some of these policies that we've been able to do include the primary health care under one roof, the Basic Healthcare Provision Fund, which is a provision of Section 11 of the National Health Act 2014, as well as the Vulnerable Persons Fund created by the National Health Insurance Authority Act of 2022. The questions now will be, how well have we performed in the implementation of these policies? What are the gaps in our primary health care? And also, how can we perform better in making our primary health care fully functional, especially given the goal of the Federal Ministry of Health and the government of Nigeria to make sure that one primary health care per ward is fully functional in the country. For the answers to these questions, we are going to provide these answers, but that's going to be after this break. Do stay with us. Welcome back to Talking with Dr. Laz, your favorite health program on television. Yes, just last week, there was a very special report that was launched, the State of Primary Health Care Service Delivery in Nigeria, that looked at how the states and the Federal Capital Territory are performing in terms of primary health care. The report looked into the available policies, the structures, especially the governance structures in its implementation, as well as the performance of the states on the National Demographic and Health Survey, looking at indicators that have to do with reproductive, maternal, newborn, child, and adolescent health, looking at that as the baseline. And this report covered 2019 to 2021. One campaign, National Advocates for Health, the World Bank, and their partners came together, of course, working with relevant government institutions at the national and subnational level to gather this data and rank the 36 states and FCT. The question will be, where does your state belong? We're going to put that ranking on the screen, and that's going to form the basis of the program today. We'll be hearing from a number of health professionals, health advocates, as well as some leaders in this country, especially from the National Assembly, what their thought is about how well we fared in primary health care. So let's look at the summary of the report. As you can see, all the 36 states and the Federal Capital Territory have been ranked. Top on the list is the Federal Capital Territory, FCT. Enugu State is second. Anambra State is third. We could look at that. In the bottom three, you have Zamfara State as the 37th. That's the least or the worst in terms of the performance, looking at the indicators that were used. Sokoto State is 36th. Taraba State, is 35th. So you may want to check out the full report, and you can download it at www.sphcn.ng. You can also see that on the screen. So you download it. It's over 170-page report. The Talk Health Nigeria team was at the public presentation of this State of Primary Healthcare Service Delivery 2019 to 2021 report, and we asked the country director of One Campaign, the lead organization that led the production of these reports, on the rationale why they think this is important, of course, with their partners in coming up with this report. And this is what he had to say.
As an organization, for over the years, we've worked on the Make Nigeria Stronger campaign, a campaign that was focused on basic healthcare provision fund. We target health because health education are one of the building blocks for lifting people out of extreme poverty, and primary healthcare service delivery targets the extreme poor in Nigeria. So we thought that delivering quality healthcare will help improve outcome and lift more people out of extreme poverty. In doing that, we thought that we thought that campaigning for improved funding will lead to improved outcomes. Once the funding became available, we wanted to make sure that there is accountability mechanism inbuilt into it, independent assessment. There are already some accountability mechanism within government system, but you need an outside view to see if the fund is being utilized and if it is delivering expected outcomes. So we convened a meeting with partners and we said, attention around basic primary healthcare provision has now shifted to states who are now receiving the fund, because the fund is now moving from federal. And we must remember that this BHCPF is a federal intervention. The responsibility for delivering quality primary health care service lies with states and local governments, right? So what you have at the federal is intervention, and we have encouraged federal government to intervene by setting up the funding and releasing the money. Now it is now important that we turn attention to see that the money is being used for the purpose it was meant for, so that the intervention fund does not enter into a sinking hole, right? So our partners agreed that it would be important to do a holistic review of because it's easy to target one or two states and focus all your energies on one or two states. But as we have seen, health outcome affects all, and once one state is doing poorly, it has ripple effect on others. A simple outbreak of disease in one of the poor performing states means that we can have it spread across the country very quickly. So it's important that we make sure that we're holding everybody's feet to fire at the same time, right? So our partners put in all the effort, put in all the work, deployed all the resources, and to make sure that we are able to put together a comprehensive first view. And it's important to say this is first view of what is going on at the states. And as we have learned with our partners, everybody has all sorts of things that they expect this report to cover, and we are looking to continuously improve on those things. But again, this is a first view, and when you compare to other reports, either in silos or all of that, you will see that it also represents what the findings are. And our government partners are also acknowledging that there is room for improvement, and they are already preparing for that improvement.
Dr. Chijioke Kaduru is a public health consultant who led the production of this assessment. He led the team that carried out the assessment. And we asked him about the how, the methodology, what did they look at, and this was his response.
What we've tried to do has been to review the reports across different states, as well as their policy guidelines and some of the plans that states have put together. This review has then been supported by additional consultations with people in the state, and then validation with government partners and a wide array of stakeholders to help ensure that what we're finding in the report is actually reflecting some of the realities on the ground. Now, we did this all the way into the fourth quarter of 2021 to be able to collect all the data that was required for this process. And one of the things that we've promised states and citizens and partners is that in the second round of this report, all of the progress that states have been making since that fourth quarter last year will be captured as well at the end of this year. So we know that some states would say that they've been pushing well forward since the last round of data collection. We're excited about that. It means that people are reacting to the report, and it means that people are working harder to get health to the citizens. So we hope that in the next round of the report, all of this progress will also be captured. But that's essentially how we've gone about being able to rank the states across some of what we consider priority areas within the primary healthcare space that they should be covering as states delivering health to the people.
The Senate Committee Chairman on Health, Senator Ibrahim Oloriegbe, was also at the event. In fact, he led the formal unveiling of this report, and he shared his thoughts on what he thinks could be done, especially at the subnational level, in terms of making our primary health care to function optimally.
I think one, at the state level, is for the state to allocate more resources to health and to get those resources released and utilized appropriately. Just like we said, Basic Healthcare Provision Fund, just like UBEC Fund also, when this federal release their money, there's a need, there's always a requirement for a counterpart from the state. This counterpart is not released. That's why you don't get the service done. So what the citizens will demand is for the states to allocate and release appropriate funds for health. When we talk about release funds, it's not only that, many states will say, I have staff, I pay their salary, that's my contribution. No, you pay staff, just like the doctor of you may pay staff salary, people come to work, they have nothing to work with. There are no drugs, there are no supplies. Even when somebody gets a wound, you don't have iodine and so on to dress that wound. What is the essence? So people go to public health facilities, they get only a prescription. Or the doctor may not have, or the nurse may not have a sphygmomanometer to measure the BP, or even a thermometer to measure this thing. So that's about us. In many of the states, you see governors building fantastic big hospitals and commissioning it, which are non-functional. So that's one. But two, again, we have issues with human resource for health. That is, how do you retain? How do you need to recruit and retain and motivate? We have, if you are a nurse in this country, except in parts of security, you have a job on day one, despite that there is unemployment, because we have deficit. Because a lot of our nurses and doctors are going out. Why are they going out? Because they are not well paid, they are not motivated. Particularly the rural areas where majority of Nigerians live, they don't have health workers to be there. Governors need to be able to do this. That is, for you to motivate is money, isn't it? So the other thing is there's a need for better monitoring of the resources that are allocated. Yes, I'm advocating for more, but even the little that is there, how are they utilized? Are they utilized effectively well for it to be able to do the services that we expected? If you're able to address this, if the citizens are able to demand this, well, there's one final one, which is what I would call the citizens' participation. The primary healthcare system that we have in this country established a mechanism where you have health facilities committee who are supposed to be members of the society in that environment, who are elected by themselves to oversee it. But they should not see it as a political appointment. They should see it as service. I would expect many people to either appoint or elect people that have gone through services, that are retired, who are back to the village or back to the community to give back. But they are not there to be able to take back. They are to give back. So if these are effective, they'll be able to hold the health workers accountable. They'll be able to demand from their government, local government, state government for more resources. These are some of the things I recommend.
So it's not just the organization that carried out the report or the Senate Committee Chair, but we also heard from two commissioners for health. Enugu State ranked second, Nasarawa State ranked sixth on this state of primary healthcare ranking. And they talked to us on what they are doing right and perhaps what they intend to do better going forward. You're going to hear what he said, but that will be after this second break. Do stay with us.
One of the things that must have worked for Enugu is having an enabling environment for the health sector to thrive. And that enabling environment could only have been created by the administration that we are currently having, because the report looked at a particular period, and that period has, you can recognize that there was an administration in charge in the state within that period. I always say it, that it's one thing to have all the technical know-how and the technical information, but being able to have the political class that will understand or will even give a listening ear to the technical information that is being brought forward. We have an administration that has allowed the things that were measured in this report, which have to do with the institutional things that were put in place, the health sector reform law, the acceptance of the basic healthcare provisioning fund, ensuring that the parameters that were ranked are in place. For example, implementing primary healthcare under one roof, ensuring that there is a state primary healthcare development board, and then a universal health coverage agency and a board, to ensure that the gateways are able to perform the way they should.
I think it's a good event for us to come here to see the ranking of the state from one campaign. I'm impressed that the Nasarawa state is ranked among the 36 states and the FCT. We came sixth alongside with Abia, Lagos. That was quite impressive. And the area of our gap needs has been quite well, and is going to have also been identified. I'm quite in the know of the effort we have done, and will continue to do such in such circumstances. One of the areas is stillbirth attendance and other activities that goes within. The state is quite impressive, and we're doing the best we can. Few of the wards that we don't have the primary health care, the governor has also given a growth. We started building, and we have enhanced such circumstances of such that goes in. The issue of tax shifting to other lower cadre of health personnel has been on, and with a good domain, we have also installed the state health insurance schemes. It's quite very effective. Vulnerable recruitments and counting of doses has also been enhanced. We believed in the next ranking will come beyond the 6 positions to beat other states that have been. It is quite touching. Apart from the FCT, none of the northern states has also come up on the seat. We are second in that circumstances, but we wish to be among the first 3 competing states in the ranking. That's our intention.
That's the spirit. We expect to see more progress from Nasarawa State going forward, and indeed all states of the Federation. Some health experts and health advocates also talked to us, and they shared their thoughts about this report and what we could do with it to ensure that when the next ranking could be done, we'll observe overall improvement in primary health care across the country. And let's hear what they had to say.
The production of this report has informed us of so many things that are really happening, which are not really palatable, you see, at all. In the 8th National Assembly, towards the implementation of the basic healthcare provision, you see, fund, there is one fundamental thing which must be done. Our research shows that only 2 tranches of releases were made in 2018 and 2019. And that means for the past 3 years, there has not been any release of this fund, you see, to the stage. So that means one area which the federal government must really work on is on the release of the fund itself. Nigerians, millions of Nigerians, millions of children, the underprivileged, the poor today are dying as a result of lack of medical care. And you have billions lying there, which ordinarily should have been released to the states, to the primary healthcare centers, you know, for the benefit of Nigerians. But we will intensify our advocacy, raising our voices as national advocates to the federal government level for that release. The second thing is on even the utilization. From what we have seen, from what we have really had, if we are not careful, these monies will be going the way UBEC fund is going, really.
At federal level, we recognize the fact that government has made the funding a first-line charge, and there is that ongoing debate on can additional funding be deployed to supplement outside of the recommended 1% CRF. The other thing is also about fund releases, because when it is, now that it's statutory fund, when does it go to the fund and the disbursement? There are already clear timelines of when the money should be transferred from federal to states and to those health facilities. That is already clear, right? One area we think there is room for improvement, and the National Primary Healthcare Development Agency alluded to it, is the deployment of technology to the management of the fund. This is one critical step, and the agency is already hard at work, right? But unfortunately, the report only recognizes what is already existing, assessing what is already existing, not what is ongoing, right? But we know from conversation that the National Primary Healthcare Development Agency is already hard at work at deploying technology. But one aspect of all the three gateways, the emergency gateway under the BACPF is not fully operational, right? It's extremely important. I know, from conversation also, there's a lot of effort that is going into getting that aspect off the ground. But when you look at the three gateways, it's obvious that the three of them must work for you to see an improved outcome, right? MPCDA, PACDA is doing well. The National Health Insurance Scheme gateway is doing well, but the emergency part is still outstanding. So concerted effort must go so that the three of them are working at par, so that the outcomes are delivered at the same time. Because if one person delivers theirs and the other person is failing, it eventually affects the outcome. So we need to make sure that the three of them are delivering at par.
I think what the state of health ranking has actually highlighted is the critical gaps we've identified in the implementation of BHCPF. But beyond that, the voices of the citizens is critical. We need an active citizenship for health, and we need to have citizens actually demand for better health care, especially at the primary health care level. Citizens, we have found, are not as engaged. Why? Because they do not often have the required information to be able to advocate for themselves for better service delivery. So what this report we hope will do, it will actually show states show citizens how their state is performing, and be able to demand for better health care, and actually show them that some states are performing well, and understanding why they're performing well. And so using their own voices, be able to demand from their governors, be able to demand from their local health authorities, demand from their state legislators. We want better health care, and that, I think, is the critical voice of citizens.
Fantastic opinions there. Yes, a number of stakeholders also share their thoughts on the need for more actions at the state level, and also for citizens to lend their voices, using these reports as data they could use to engage their policymakers, especially as we move into election next year, use it to set agenda. Let's hear what these stakeholders told Talk Health Niger.
This is a very good first step initiative. It's not done yet. The report is a good attempt at looking at what matters, looking at health at primary healthcare level. I think the report needs a lot to be done. It needs to be, there are lots of things, and I'll be sending reports to them, areas that they need to focus on in the next iteration of the report. But even as it is, for me, the immediate next step is to actually take this report to the sub-regional level, at least at the three geopolitical zones, or even the 6 zones, and explain these reports to the leaders. You need to have the commissioners of health sitting there. You need to have the heads of primary health care sitting there. You need to have governors and deputy governors. You need to have commissioners of budget and planning sitting there. You need to have my counterparts on SDGs sitting there. These are not the population for this dissemination of the report. So in this case, I think work has not been done because the impact is at state level. So once that is done, then we'll look at what are the specific things that the states need to have. And that include all the 3 elements of the Basic Healthcare Provision Fund. And each state will then have an honest conversation of where they are and where they need to be.
So I think that to states, they should see this report as a challenge. It's not a game of naming and shaming people, but it's instead helping people working together, supporting people to identify where there are problems and where there are gaps, so that we can collectively work to fix those gaps. For each state, the problems are unique, and so the solutions have to be unique and tailored in the context of the state. So it's not a one-size-fits-all, but it's for states to take time, internalize the findings, understand how those findings relate to their reality, and start to work forward to actually be able to use those findings to improve their work. And for citizens, it is important for you to know that health is your right as a citizen of the country, and you must continue to demand it across all of the different elements where we continue to expect our states to perform in health service delivery.
I think one of the issues that we have is when we talk about these issues around healthcare or whatever it is, we're always looking at the federal. Everybody's talking about federal government, federal government, federal government, when in actuality a lot of the action, particularly in the health sector, is at the state level. And here we have a very valuable tool to evaluate the performance of various states in a very, very important program. So it's up to us as citizens, civil society, to take this information and use it to, first of all, hold our governments accountable, to say, look, for those that are not performing well, you need to pick up. And for those that are doing well, pat them on the back, but there is room for improvement in every single state across the country. So that's very, very important for us citizens. Arm ourselves with this information, know what is happening on the ground, and then use that to push government. That's the way democracy works. So I have to applaud everybody involved who has put this report together, but now it's up to us as citizens to carry it and use that to, really improve the delivery of healthcare in the country.
The One Campaign Country Director, as well as the Senate Committee Chairman on Health, made further recommendations on what could be done, and also actions at the state, and for us, the citizens, we the people, what we need to do, because health concerns everybody. So let's get their thoughts again.
At the state level, one of the critical things we have found is leadership, is political leadership, and the Enugu State Commissioner alluded to that. And I think that first it starts from how the technical people are communicating in the language that the political leaderships understand. That is something we need to find a solution to, right? How do we get the technical people who work on the field in the health sector are speaking the language that the political actors need to understand? But also we need to get the political actors to make the effort to understand, because if you have run for office and you said you want to improve outcomes for citizens, right? Your priority should be, how do I improve that outcome? And it would mean seeking knowledge and understanding of what the challenges are and how it can be solved, right? So even if the technical people are not coming to you with the language you understand, go to them and force and ask questions until you find that answer. But one critical thing I want overall is that citizens have the biggest role to play in helping to deliver quality health care. And as I research and experiments have shown that where citizens ask questions and demand for improvement, political actors respond. There is nothing that political actors take as serious as their popularity currency. It's extremely important, and asking questions is also a way of testing that currency, and they always repay once you put that front of them. So citizens need to be conscious and actively put in that effort to ask the questions of our political leaders.
It's about the relationship between governors and assemblies. The assemblies in the state don't have the necessary or required independence that a parliament ought to have to be able to perform their role of oversight on the executive. They are like an appendage of the executive in many states. So what you say, what we have to do? I think it will be for citizens to have better understanding and empower the legislator. When I say citizens empower them, is for them to support legislators when they take some actions that are legal against executive at the state level. At the federal level, why you see things happening is because the actual independence and interdependence are supposed to happen is happening. As parliamentarians at the national level, as senators, House of Rep, you can see we are able to perform our oversight effectively. We want to do it on executive arm. And the president, even the president is not overbearing. The president doesn't call at will the leadership or say we should remove leadership. It has not been happening. This is what we need to address. It's a general issue, not specifically basic health care. Because when you see in many states, once any legislator wants to raise something against the executive, which is genuine and legitimate, the governor will either say they should suspend that person, the other colleagues will suspend that person. So it's about how do we empower, through our voice, empower the citizens to have their power. I was in conversations like this some few weeks ago, where I've said that for our democracy to really be strengthened in this country, the citizens need better understanding of the roles of the parliaments. Because until we get the parliament strengthened, we can't get what we need to get from democracy. Well, there's one final one, which is what I would call the citizens' participation. The primary healthcare system that we have in this country established a mechanism where you have health facilities committee who are supposed to be members of the society in that environment, who are elected by themselves to oversee it. But they should not see it as a political appointment. They should see it as service. I would expect many people to either appoint or elect people that have gone through services, that are retired, who are back to the village or back to the community to give back. But they are not there to be able to take back. They are to give back. So if these are effective, they will be able to hold the health workers accountable. They'll be able to demand from their government, local government, state government for more resources. These are some of the things I recommend.
Wow, that's well said by the Senate Committee Chairman on Health, Senator Lori Egbe. Generally speaking, our primary health care is not in a good situation. Even the FCT that took first, there's an assessment. I led a technical team to carry out an FCT, and just about 20% of health facilities in the FCT said that they had regular access to electricity, and less than 50% have regular access to power supply. Of course, human resource for health, all of them are on red because there's gross inadequacy in terms of the number of staff in FCT. And if it's that way in FCT and they're topping this table, then that tells you how bad things are generally. But in terms of the solution, all of us, everybody have a responsibility to make our hospital work, or as one campaign may put it, make Nigeria stronger. Over 80% of our health needs can be met by a fully functional primary health care. And primary health care is not rural health or health care for the poor. Even in cities everywhere, primary health care is applicable. So what are you doing? Play your part. That's the much we can take today on the program. And I really thank you for watching. And I thank all the persons who talked to us. And I commend One Campaign and other partners, the World Bank and all of them that put this report together. And I thank you, the production team that's helped us to produce this program. My name is Dr. Laz Eze. I'll see you same station, same time next week. Bye for now.